Thank you. Okay, everyone. A couple of housekeeping items. First, Terry, I don't think you understood me last time. Next time, let's cut down the bio a little bit. Even that's tough for me to hear. We don't need to do all the letters. Everybody can see that. Next, make sure, Harry, that you look at your chat box. I've sent you a couple of messages, and you'll need to answer those for me before the end of the program. Okay, everybody should have a PowerPoint presentation in front of them. You'll also see it up on the screen. And we're going to talk today about some coding and reimbursement issues and some guidelines when it comes to NPPs, mid-level providers. And what NPP acronym means is that's a non-physician practitioner. Now, the acronym really focuses on nurse practitioners, PAs, and clinical nurse specialists. However, when you consider an NPP, it can be anybody that's really not a physician that possibly could submit services for billing. And so we're going to look at all levels of that NPP, but really focus on the mid-level providers as well, mainly because there's some confusion as far as nurse practitioner versus RN, what a medical assistant can do, nurse practitioner versus PA, and there's some state rules that you have to follow as well, making sure that you're not going too far off the grid, or you have to understand that some of the PA rules are a little bit lower than what the lower, meaning that there's less flexibility in what they can provide independently than what a nurse practitioner could do because there's different levels of education. So make sure that you're aware of that when you look at some of this information. So when we look at slide 2, we're looking at some of our objectives here. So we want to make sure that our managed care companies and our private carriers recognize and pay for NPP services. Some of them don't. They'll say provider not recognized. And so a lot of times you'll see that with Blue Cross Blue Shield, but hopefully it's getting better. Medicare rules is really what we focus on because that's what's considered really the gold standard, and we have to follow what they say. Looking at Incident 2 rules, that's really a billing term for Medicare, and understanding what that means and identifying what the supervision rule that applies not only in Incident 2, but then when we switch gears when your mid-level providers are performing diagnostic testing. And then can, nurse practitioners or PAs perform consults? And the short answer is yes and no. And so we have to know in what setting that's okay. And then the true definition of what an NPP is. And so we're going to take a look at all of that. So non-physician providers. So state and federal laws allow basically physician services and procedures, and they can direct bill to Medicare. Then that's really where you're getting into your mid-levels. So, a nurse practitioner could basically, hang a shingle out on their door and bill out their own services. They would take a 15% reduction as long as they had a collaborative physician within a 50-mile radius. A PA is a little different. So can they bill independent services? Yes, but they have to be an employee of a physician. For the most part, there's a couple of states that are a little bit more relaxed on that rule, but you want to really check your state rules as well. So PAs, physician assistants, NPs, nurse practitioners. CNS, that's a clinical nurse specialist. I don't see many of those, which is interesting because they're easier, I don't want to say easier, but it's easier to achieve that credential, and then also they have the same rules as NPs and PAs, and they're actually a lesser expensive, employee. So something to consider when you're looking at NPPs. Certified nurse midwives and then medical assistants, they're limited to the nurse visit, which is the 99211, and they have to be, working under a physician's practice. Certified social workers, and then CRNA, certified nurse, RN anesthetist. So there's different levels of non-providers, and we want to just make sure we're aware of what level we're focusing on. So first of all, the rules for NPPs, and I've given you a couple of links as well, so you don't just have to take my word for it. You can actually link on the information and find the download for the regulation of what I'm talking about. So they have to have a national certification or license, must have state license as well and registration. So it's not just from a federal standpoint, but it's also from a state standpoint. If you have an NP or a PA that does not have hospital privileges, they will not be a profitable employee for you. So make sure that you get them credentialed with the hospital. They might even have what they call provisional privileges, meaning that they're working under one of the physicians who actually has privileges at that hospital. And that's fine too. You just have